Well, the White House has a plan to reopen the economy, and the Trump administration proposes that this happens in phases. But exactly when that should happen, they're leaving that up to state leaders like governors. Ian Lee has the details.
America wants to be open.
President Trump released a three-phased approach to reopening the country.
We are not opening all at once, but one careful step at a time.
The guidelines lay out a gradual opening of businesses as the coronavirus outbreak is beaten back.
This is uncharted water. There may be some setbacks that we may have to pull back a little and then go forward.
President Trump says some states already meet the requirements to start phase one, which opens restaurants, gyms, and places of worship.
They will be able to go literally tomorrow, yes.
The guidelines aren't mandatory. In a conference call with all 50 governors, President Trump told them to call their own shots.
It's been confirmed by the president that he will not be interfering with our Stay Home, Stay Healthy initiative.
The president's plan puts much of the onus of testing and tracing on states and employers.
It is the single best tool to inform decisions.
New York Governor Andrew Cuomo says the federal government needs to help.
There's no reason why you would have 50 states each trying to figure this out on their own.
17 states have formed 3 regional coalitions to coordinate with one another.
We must get this right. If we don't do it right, the consequences are horrendous.
Ohio's Republican Governor Mike DeWine said it would be disastrous if businesses opened back up too early and coronavirus cases spiked. Ian Lee, CBS News.
Let's bring in CBS News Chief Washington correspondent Major Garrett. He's joining us now to talk through all of this. So, Major, it's an interesting point that Governor DeWine makes there. And my sense is that what's happening in Washington is as much a political calculation as it is a public health one. And should a certain state or a certain state economy reopen too quickly and the virus surges once again, the president obviously wanting to point to the economy as a feather in his cap could suffer some serious repercussions if a state or certain communities within a state that rush to reopen see a resurgence of the pandemic.
There are a lot of things to weigh here. You have the economic damage of the stay-at-home and lockdown orders. You have the public health concerns. Plus, you have this data stream. What are the cases? What are the hospitalizations? What is the testing capacity? What's the testing data in various states or counties? All those things have to be weighed. And the sum total of what the president announced yesterday is a very, very cautious pro-public health side of the ledger on this. His own inclination and several of his advisors I've talked to this week want him to reopen the economy much more aggressively. But this three-phased system not only defers to the governors, which the president had to do anyway, and he needlessly created all sorts of confusion about this week, which disabled his ability to address this issue with clarity to the country. But now that that's been dispensed with, the governors are in charge. They have at least a set of guidelines they can go by. And the guidelines emphasize a lot of things, not least of which is the capacity to enlarge testing of frontline healthcare workers and those going back to work. And basically, when governors look at it and say, we don't have the testing capacity, then they're not going to go through these phases. And so testing is integral to this, but so is the public's willingness to go back to work, companies' willingness to try to invite customers back to work and their own employees back to work. And all of these things are being measured and absorbed individually at cities, counties, and states. The one thing that I think governors are asking for is some greater impetus from the federal government to enlarge and expand testing capacity, using the power, purchasing and otherwise, of the federal government to expand that, much the way the federal government did with access to and availability of ventilators. That's probably the next situation the White House Coronavirus Task Force is going to have to confront, whether the president says so or not. Federal involvement that is much more muscular to increase testing capability and the data that comes along with that increased capability.
That is the question that I wanted to ask you about what the federal government is sort of taking responsibility for throughout this whole COVID-19 experience. There's been a lot of kind of back back and forth as to, well, who is responsible for an uptick in cases? Who's responsible for buying enough ventilators or a ventilator shortage? With the president saying at times, you know, we're doing everything we can to get as many ventilators into this country as possible, and then other times saying, well, you know, the states didn't want to spend the money when we weren't in the middle of a pandemic, so it's on them now they're shorthanded and we're not shipping clerks. But you're right. I mean, the only way that the general public, anyway, can move forward with any kind of confidence is to have widespread testing, but also antibody testing, which is really just in the experimental stage. We're not even talking about widespread antibody at this point. It can't be done on a state-by-state basis. All the experts say that in order to contain and diminish this virus, it needs to be a national plan, because if one state opens up and they don't have the virus under control and people start moving throughout the country, then we're going to see a spike all over the place. So what is the federal government promising? Are there any promises in this phased economic opening that the president presented?
Not explicit promises, and any fair student of these briefings and the president's orientation to any of these issues is, when the news is bad, he says it's the state's issue. When the news is good, he says it's a federal government solution. That's exactly what the pattern the president followed on ventilators. At first it was states didn't have ventilators, they should have gotten the ventilators. Why didn't they prepare more? Oh, then there's the Defense Production Act, which is encouraging large corporations to move along the ventilator process. And now there are plenty of ventilators, so now that's a federal success story. Well, it can be a little bit of both. And the president loves to embrace good news that he believes he's responsible for and defer bad news that he wants to shed in some other direction. But the simple truth is, whether he wants to rhetorically embrace it or not, is the federal government is much more capable with purchasing power and regulatory action, some of which have been taken, to vastly increase testing capacity, availability, and the data that comes along with that. And so I know the task force is working on that, and some regulatory measures have been taken to speed this up. And lots of companies are working in collaboration with the federal government. But right now the president keeps talking about, well, it's a state thing. It's not a state thing in terms of building up that capacity by themselves. And just as we saw states bidding against one another for personal protective equipment and other things a couple of 3 weeks ago, we don't want them competing in the same space for testing capacity, because some states need more of it than others. But the simple truth is, to give public confidence what it needs to obtain the wherewithal to psychologically commit to going back to work, to going back into restaurants, to going back into places that we are now not entering, you need more testing capacity. And to your point, Anne-Marie, about antibody testing, and I'm not a doctor here. I've only listened to doctors talk about this. That is potentially important in terms of letting you know whether you had it and have some element of potential immunity. But that's a much more complicated test, and its availability will have to, by necessity, be ramped up much more slowly, because it's a harder test to administer and have confidence in the ultimate results of. All of these things have to come together, and the federal government is going to have to be the driving force behind this, giving the resources to the states so the states have the ability to make the decisions that are rightfully and constitutionally in their hands.
Major, that last point that you make is so interesting to me, and I want to just ask you about that. I wonder if there's been any kind of gauging of this public confidence that you mentioned, because it's one thing for the president or a governor to say, hey, things are getting back to normal, we're reopening the economy. It's quite another to convince me, I'll use myself as the example, to go back to go to a rock concert, to get on a plane, to go to a crowded supermarket. I'm not doing that because there are two considerations I have to consider. One is the idea of reopening the economy. It's not like 9/11 when Mayor Bloomberg said, you should go to a Broadway show, you should spend. People are certainly spending, but they're spending on Amazon and getting their groceries delivered. So what needs to be done, and what are politicians doing to even gauge whether or not people would listen to them if they say, go back to work? No one wants to put their life at risk by going back to work because the president says we need to get the economy going again.
Right, and this is where governors are sending signals and have been sending signals through their mayors and other county officials up to the federal government for weeks now. Look, people are just not ready to make that leap into the future. And even phase one, and remember, to reach phase one, a state has to have a decline for 14 straight days of cases, hospitalizations, and at the same time, a ramping up statistically of testing availability and test results. Okay, that's a not insignificant bar. But let's say you cross that in any given state. One of the things that opens up is gyms. Wait a minute. Are you really going to go to a gym where people are working out and you are trying to, what are people going to walk around and literally wipe off everything as soon as somebody gets off a piece of equipment or a mat? I mean, I just think psychologically people are going to say, that's going to be near the end of my list. I've learned how to work out at home. I'm saying that personally, but I imagine other people have as well. So there are aspects of this that have a practicality to it and have a inducement to get the economy back up and running. And that's an important factor. Don't think it isn't. There's plenty of economic data that suggests that longer this goes on, the harder it's going to be to ramp back up, and that financial wherewithal, particularly for those in the lower middle class and low poverty levels, will be extremely difficult to rebound. So that is a compelling consideration. But alongside of that is, what is my own sense of personal safety and what is my own sense of personal confidence? And it is increasingly being viewed through the prism of testing, not from masks, not from social distancing, but testing, data about who has it, who doesn't, what is its penetrative level, how transmissible it is. All of that will be better known when there is industrial strength and industrial grade testing. And yes, we are testing a lot more Americans than we were a month ago. That is an absolute fact. The president is not misleading about that, but he is misleading or avoiding a hard truth when he says we have all the testing we need. That's not remotely true, and the governors know it.
Major, I want to ask you about another program that the administration was super proud of when they announced it, the Paycheck Protection Program. So now we've learned that it's run out of money. But even before that, there were hiccups. The small businesses that were supposed to be getting this money in exchange, I believe, for maintaining their workforce, were having a really hard time getting access to this money. Banks were choosing to loan money to businesses that they already had a long-standing relationship with, because the banks were uncertain about how they were going to get repaid. So what's happening now? Is there going to be sort of a refunding of this program? You know, these small businesses operate on razor-thin margins.
Right. So there's a lot to unpack here, and just give me a couple of seconds to do a couple of things that have a historical nature to them. This is an important program, and it is much more aggressive than anything the Obama administration did during the Great Recession. And one of the lookbacks people within the Obama administration did in a self-critical way is they should have used the Small Business Administration and loaning mechanisms like this much more aggressively than they did to do this very thing. So it's not a bad idea. And the fact that it has been tapped out at $350 billion so rapidly suggests there is tremendous demand for these loans. And to your point, Anne-Marie, there were some early glitches. And one of the problems with this program is if you're a bigger small business, you have accountants and people who are much more adept and facile with, if you will, with these forms and this mechanism. And if you're a really smaller business, you probably don't. And so they're the ones who are sort of left on the margins of this. It is a good idea. It has worked. But there needs to be much more money in that. And I will tell you, when Congress was deliberating this, there were plenty of economists saying, your target figure of $350 billion is way too low. You need to be 3 times that amount. For whatever reason, Congress and the White House didn't press for a higher number. Now the fund has been exhausted. There's nothing left. If you're a small business and you want to get this money, there's none left for you to get. So Congress has to replenish that. Well, here's the stumbling block. Republicans want to do that. But Democrats have said, okay, that's not the only need out there. Look at state budgets across the country. State budgets are collapsing in terms of revenue. Why? Because business activity is, by order of the government, reduced. Well, states, unlike the federal government, most of them have a constitutional requirement to balance their budgets. Many cities do as well. This revenue shortfall is a emerging significant fiscal problem for states and localities. Democrats are saying, federal government, we can't ignore this. It's going to come to us at one time or another. We might as well put more money into the system to help states deal with this because we know it's coming. That's one of the central disagreements. The administration doesn't want to provide that state aid quite yet. Democrats are saying, we know it's coming, let's pay the bill now. And it's that impasse over which bills to pay and in what order is blocking the replenishment of this Paycheck Protection Program administered by the Small Business Administration.
Major Garrett. Major, before we let you go, I know this conversation has been going on for quite some time, but I just got to point to the president's Twitter feed. I'm sorry to do this to you, Major, but the president is on a tweet storm tweeting, liberate Minnesota, liberate Michigan. That's all he's tweeting. He's tweeting two words, liberate and then a state. Is that just that kind of language that a state is somehow not free because of these public health measures that have been put into place? I mean, what's this, when you talk to people at the White House, when you talk to people there in D.C. and on the Hill, what are they saying as to what the president's sort of strategy is when he uses language like that on Twitter?
Well, you can go back to yesterday's briefing. The president was asked a question about protesters in Michigan, and because they were chafing against the state stay-at-home order. And the president was asked, do you want to send a signal to those protesters? Do you want them to follow the recommendations from the governor? You've told the country, and you told every governor on a conference call, you're going to make the calls. The power is in your hands, which is a fact. It was also an important thing for the president to say because he created so much needless confusion about that earlier this week. The president, given an opportunity to say, everyone should adhere to these guidelines, everyone should do this, he said, no, I just know that some of those supporters like me, and they're wanting to get back to work, and that's all. And now these liberate tweets essentially give his voice to those who are wanting to push against social distancing, stay-at-home orders, and the like, creating maybe a little bit of political upswell for him among his supporters, but also creating deeper confusion and undermining the ability of states to do what the president told them yesterday he was empowering them to do. And it's this level of mixed messaging from the White House, which is in the hands of one person and one person only, President Trump. President Trump is the only mixed messenger in his administration. Dr. Fauci isn't a mixed messenger. Deborah Birx isn't a mixed messenger. Vice President Pence isn't a mixed messenger. Vice President Pence says, follow the guidelines. Follow the guidelines. They are helping us flatten the curve. They're helping us reduce the crisis in many hospital systems that were overwhelmed. Follow the guidelines. Giving a rich and open opportunity yesterday at the briefing to say that, the president deferred. And now these liberate tweets create even more confusion, and they create traction among his supporters to be socially or civilly disobedient at a time when everyone else in his administration is saying this is not the time for civil disobedience. This is not the time for social protest. This is the time to adhere to the guidelines, bring the curve down, get your state in a place where it can reopen safely. And it's that mixed messaging that one person owns completely, and it's the president of the United States.
Major, thank you so very much. I know we kept this going for quite some time, and I know our producers are sitting in their living rooms across the tri-state area pulling their hairs out, but so important to get to all of this. We really appreciate it. And my one thought, and you don't have to answer this, Major, it's for another day, but I wonder how newly minted Chief of Staff Mark Meadows is feeling throughout all of this as we look ahead to the next week. Major, thank you very much. We're going to take a quick break, and don't forget, if you want to get more Major Garrett, Major's got his podcast, Debriefing, The Briefing, and The Takeout, which is coming back to CBSN and CBS News Radio. So you'll want to try to download that wherever you get your podcast. We're going to